Good afternoon, everybody, and welcome to this edition of Wellness Wednesday with TouchCare. Today, we have a very special guest on the line, Dr. Skrombolas. She is going to take us into a little bit more detail about dental preventive care. So, learning about how often to go to the dentist, what you can expect from your visit, and just a couple other tips that you can use going forward to make sure that you have the best dental care that you can. So, of course, with TouchCare, we can help you to find a dentist in the event that you need one. We're there for you Monday through Friday, 8 a.m. to 9 p.m. to kind of provide you with a good provider that meets your preferences and that's in network so that you can get the dental care that you need. So with that, I will just introduce Dr. Skrombolas quickly. Here's a picture of her and a little bio just so you learn a little bit about who's on the phone today. Dr. Skrombolas earned her Doctor of Dental Surgery from University of Buffalo and completed her advanced education in general dentistry at Albany Stratton VA Medical Center. So right now she practices full-time at Unity Dental, and that's located in Penfield, New York, and she treats both adult and pediatric patients. All right, so Dr. Skrombolas, with that, I'll just jump right into our first question. So what would you say are the benefits of even having a dentist?
So having a dentist is really important, especially when you find yourself in a situation where you have possibly an emergency or something that's bothering you. And by having a dentist, that'll give you somebody to call that you've met before, to discuss, any issues that you may have going on or even just any questions. A lot of times what happens, and I see a lot of patients like this, if they've never been to the dentist before, the first thing that will typically bring them in is either pain or something that's been bothering them, and that can be a little bit stressful for a person. And then also going to somebody that you've never met before for something that you're in pain with is also a little bit stressful. So having that dentist and knowing them and having a relationship with them is very important, to see them regularly, but also if in the event you ever have an emergency and you need to give them a call, you actually know who you're calling, and that kind of puts people more at ease.
Great, thank you. So what is the difference between a dentist and a dental hygienist?
So a dental hygienist is usually the professional that you see to clean your teeth. So every 6 months, we recommend that you come in for a cleaning. About every year, they may do a measurement called periodontal charting, where they'll measure how your gums are attached to your teeth. They clean, they polish, they take x-rays, and then the dentist is actually the person that comes in and will examine everything to determine if you have any further dental needs, if you have any infection, any decay, and then the dentist is the person that would then treat those issues if you have any. So that's the main difference. The dental hygienist will do the cleanings and just kind of educate you, give you information, and then the dentist is the one that does more invasive procedures.
Great. So how often should somebody visit the dentist?
We always recommend that you visit the dentist at least every 6 months. So this gives you the opportunity to come in for a cleaning. It gives us the opportunity to take a look at everything, make sure you don't have any cavities, you don't have any other pathology or swelling that would be of concern. Not only do we look at your teeth every 6 months, but we'll check out the entire oral cavity. So we'll make sure your tongue and the tissues around the area, your glands and your neck aren't swollen and that things are in really good shape. At that 6 month, we call it a 6 month recall. If we do see anything, then you may come in for another visit with your dentist to be treated. But usually every 6 months, that's what we would recommend. We try and update your x-rays every year to make sure nothing is going on as well, because that gives us another visual into your dental care. But yeah, so 6 months is definitely the recommendation.
All right, thank you for that. So now we'll move into the exams and get a little insight about what to expect from that. So can you let people know what to expect from an oral exam, what the procedures are that happen during that? that time?
Yeah, so when you come in for an oral exam, typically it is for one of two reasons. You're coming in to get a cleaning, or you're coming in for a specific need that you have. So if you're coming in for a cleaning, you can expect to meet your hygienist. She'll bring you in, she'll review your medical history, make sure we have updated medications that you're taking, any history that's significant, diabetes, high blood pressure, review all of those things. And then they would start either the cleaning, taking x-rays, and updating your dental chart in that way. If you come in for a specific issue that you have, you would most likely see the dentist that day. So you would come in, they would introduce themselves, review your medical history as well, because we want to make sure that anything that we're doing isn't going to affect something that has been previously done, or any issue that you have. So if you have high blood pressure, you want to make sure that that's under control before we do anything invasive. So if you see your dentist, then they would try and handle that issue that you have on that day. So say you're in pain, say you have a chipped tooth, whatever your issue is, you would see the dentist, they would review it, they would take x-rays, and then hopefully in that same visit you would be able to get your issue resolved, either get a filling placed on a chipped tooth or, a cavity filled, that sort of thing.
Okay, so how do people overcome a fear of the dentist?
This is a little bit more challenging. So a lot of people have had previous poor experiences with their dentist, and that keeps them from coming in for just regular checkups. And it's unfortunate because when they do end up seeing their dentist, it's when, like we talked about, it's when they're in pain. So if you already have a fear of the dentist and then you're also in pain, that stress level that you have is already at a high. So finding somebody that you get along with, and that would help put your fears at ease. Once you find a provider that you like, a dentist or a hygienist that you really like, I would say stick with them. If you find somebody that's okay and you're still not comfortable with them, then by all means, it's within your right as a patient to find somebody that you get along with, especially somebody that's patient and understands that you do have a phobia or a fear of coming in. Once you find that person, there's a lot of different things you can do to kind of help you through the procedure. So if it's cleaning that you're getting and you don't like the sound of the instruments, wearing earbuds would be really helpful. So listening to music, or even wearing earplugs, or some offices even have television so you can pick a show that you want to watch while you're getting work done. Another option that is for people with really, really severe anxiety is you can talk to your primary care provider as well as your dentist, and they can give you some sort of medication to calm you before you come into your dental appointment. So you can take your medication about an hour before you come in. Somebody would have to drive you to your appointment and pick you up from your appointment, but that is a really helpful way for people with severe anxiety to help them get through their reservations about coming in for dental appointments.
Dana, we may be having a technical issue with the screen.
Yeah, I see that. Sorry about that. Let me just pause for a minute. Yeah, sorry about that. I'm not sure why that's coming up, but here we go. I got it back.
Gotta love technology.
Okay. Right? Okay, so the next section is, how does oral health impact overall health and well-being?
So a patient's overall health is very important, and that's why we review it before we start any procedures in the dental chair. So if you have a lot of comorbidities or a lot of diagnoses, say you are diabetic, or you have high blood pressure, or you have a history of cancer treatment, all of these things are very important to share with your dental provider, and they're very important to share because they also impact your oral health. So if you have diabetes, for example, that affects your healing rate. So if you were to have something done, like say an extraction or getting your tooth removed, typically patients with diabetes, they heal a little bit slower. So it's good to know your entire medical history, and it's good to share that with your dental provider. Now, if you have high blood pressure, then that's also a very important thing to share with your provider. So just being open about everything, because a lot of times patients will think that, oh, you know, that surgery I had on my knee, I mean, it's my knee, it's nowhere close to my mouth. But a lot of times when you've had a major surgery, you're required to take some sort of antibiotic or preventative medication before you do anything invasive, because there's a lot of bacteria on your teeth, a lot of bacteria in your mouth, and we want to protect everything, any surgery that has been done. So, for example, like a knee replacement or a hip replacement or a shoulder replacement. Also, your overall health is connected to your oral cavity in really interesting ways. So we don't know which causes which, but we know that if you have periodontal disease, which is bone loss and bacteria that collects within your gums and on your teeth and makes you lose the bone support of your teeth, that gives you an increased risk of having heart disease. And it also gives you an increased risk of having diabetes. The same is in reverse. If you have diabetes and you have heart disease then you're at an increased risk of losing the bone support of your teeth. So keeping your body healthy and keeping your mouth healthy can impact each. So it's really important that you be open with everything that is in your medical history, and it's really important that your mouth is healthy in order for the rest of your body to be healthy, because everything is connected.
All right. Next question is, what resources do dentists provide their patients in order to maintain a healthy lifestyle?
So typically when you come in for your 6-month cleaning, the types of resources we'll give you it's always a toothbrush, a toothpaste, and some floss. And they're just sample sizes, but we show you how to use them, and we review oral hygiene instructions and how to best take care of your teeth when you're home and you're in that 6-month period where you're not seeing the dentist. Sometimes we'll have patients that have, like we talked about previously, they'll have bone loss around their teeth. So we'll give you other appliances that'll be helpful, that are samples, to clean those areas. And all of the things that we offer are also sold at, Wegmans or grocery stores or pharmacies in the area, so that we just try and give you, depending on what your needs are, the best options to keep things clean and to keep things from getting disease or cavities. And they're all things that patients can get on their own at wherever their grocery store is.
Okay. What are some common oral diseases, and how do dentists help patients manage them or prevent them?
So I would say one of the most common oral diseases is cavities. So that would just be decay or bacteria that gets through the layers of your tooth. So your teeth are really, really strong. So you have 3 layers. Your first layer is your enamel, your second layer is the dentin, and the third is the nerve that sits in the center of your tooth. So the dentin has to be soft, that second layer, so that whenever you chew something hard or you get hit or you have some sort of trauma, that softness gives you a little cushion to protect your nerve so it doesn't get aggravated. The enamel is really hard because it's what you need to chew all of your food with. So what happens is if people have, they don't brush their teeth as often as they should, so they have a lot of plaque that builds up. That weakens your enamel, and that allows bacteria to get in and start a cavity. So one of the best ways to prevent that is having really good oral hygiene practices. So brushing in the morning after breakfast, and then also brushing at night before bed, and flossing. So flossing is the only way to clean in between your teeth, and it's very important to flush out that gum and the teeth in between the teeth to keep everything clean. So preventing cavities is the most important. Another thing that can cause cavities is your diet. So if you drink sugary drinks all day, think about coffee, drinking that all morning, eating snacks all day long. Your teeth are constantly being assaulted by acidic or sugary drinks, they never have a chance to come back to that neutral environment where they're just kind of sitting, being bathed by your saliva. So that increases the risk of getting cavities as well. Other oral diseases that you can see, so preventative for the decay and the cavities is just good hygiene and thinking about your diet and how often you expose your teeth to sugary drinks and sugary snacks. So another oral disease that is common are abscesses. So those are when you have swelling or a lot of pain in your tooth. Those can be prevented by coming in often to see your dentist every 6 months to make sure that decay doesn't get all the way to that third layer of your tooth. Once it gets to your nerve, that's when you start to feel toothache pain, and that's when you can get infections, and that's when you can get swelling. So one of the preventative things for that is just every 6 months coming in, getting checkups, and making sure that things are going okay.
All right, thank you for that. So now we're going to move into just a couple tips. So you already covered a bunch of tips and ways that people can, keep on top of their oral hygiene, but do you have anything else in terms of best practices to keep on top of good oral hygiene at home?
So like we said, brushing in the morning after your meal and brushing at night, and then nothing to eat or drink before you go to bed, so that your teeth have no plaque on them, and then your saliva is what naturally cleanses your teeth. It's able to do that throughout the night, so you don't have plaque sitting there in a warm environment with your saliva starting to cause bacteria. Another option is, like I said, depending on the type of patient you are and the type of teeth that you have, you may need a water pick at home. So a water pick is something that we recommend for people who do have bone loss, and it really does help flush out the gums better than what you can brush away. It does not replace flossing, but it is a really good way to really cleanse any plaque or bacteria that has been collecting around your teeth. So I would say if you talk to your dentist, they will have recommendations for you specifically, but really that brushing after meals and flossing before you go to bed to make sure that all of the plaque is gone is really important. And if you have an oral rinse like a Listerine or Axe, it's really beneficial to use it, and you should swish for at least 30 seconds to really get the full benefit of it.
Okay, great. So moving more into the pediatric side of things, what age should a child be brought to see the dentist initially?
I always recommend that as soon as your child has their first tooth, so whether that's 12 months, earlier, later, that's when I think you should bring them in to see a dentist. And it's not because they're going to need to get a cleaning or they're going to be able to do much, but it's important, just like for an adult, that a child has a dental home. And what I mean by that is if when they first get a tooth, you take them in, they get to meet a dentist, that's going to be their dentist, they get to see the office, that kind of helps put that child at ease. Because what happens a lot is, children get their teeth in at all different times, but once they start to walk, there's always the chance that they're going to have some sort of trauma. So if they're walking and they bump their face or they fall on their face and they have bleeding, then you have a child that's very upset and crying, and then you have a parent that's very upset trying to figure out what to do. And if you've already set up that connection with a dentist, that's really important, because then you know exactly who to call, you know exactly where you're going to go, and you'll be able to get your questions answered. Typically, because like that happens with children, they fall, they bump, whatever. Typically, it's just a phone call and your mind is put at ease. But when you don't have that, it's just that increased stress level that you really want to avoid. So if you ever, and also with children, there's pediatric dentists. They are specific to children. They get more training in order to treat children, and that's all that they treat. So typically their offices are really friendly for children. They have a lot of games for children. So that's what I would recommend. I would recommend as soon as your child has their first few teeth, you take them into a pediatric dentist, because the dentists for adults aren't as, child-friendly as what a pediatric office would be.
All right, yeah, that's a great tip. So I believe this might be the last question or second to last question, but can you just answer which is better overall? So a manual toothbrush or an electronic toothbrush?
So it's not as straightforward as just saying one is better than the other. The best toothbrush to use is the one that you use properly. So if you use a manual toothbrush and you use it properly and you brush all the surfaces of your teeth and then you angle it gently up into your gums and you brush into your gums and you're brushing for at least 2.5 minutes. So think 30 seconds in each area. So upper left, lower left, 30 seconds each, upper right, lower right, 30 seconds each, and then another 30 seconds for your front teeth, both sides, then you'll be okay. Electronic toothbrushes are also really good because they do a lot of the work for you. So they vibrate or they rotate, and you just kind of have to hold the toothbrush in place. So these are really good for people who have dexterity problems. So if they can't really hold on to a toothbrush really well and they can't really maneuver very well, then I would definitely say electronic toothbrushes are good for those patients. Also, patients who have, like we've talked about earlier, periodontal disease. So being able to get that vibration and that rotation in and under your gums is super important for people who have that bone loss already. So in those types of situations for those patients, I would say an electric toothbrush is best as well.
Okay, perfect. Okay, yeah, so that was the last question for Dr. Skrombolas, at least. Right now, we're going to open it up to audience members. So anyone of the attendees, if you have a question for Dr. Skrombolas, you can enter it into the questions panel on the GoToWebinar screen. So I guess I'll just open that up for 30 seconds or so, and feel free to ask any questions you might have. While we're waiting for questions to come in, if there are any, I will just tell you again that I'll give Dr. Skrombolas a big thank you for helping us with this Wellness Wednesday and coming on and answering questions about preventive care for your dental care. So greatly appreciated. Feel free to always reach out to TouchCare for any questions about your dental coverage. So if you're curious as to how many exams you have covered for the year, you know, if those 6-month exams are covered, or what your level of coverage is for cavities or accidents or anything like that when it comes to your dental care, TouchCare can help to clarify. We can also help when finding providers, whether it's a provider for your child when they get their first tooth, or if you need one and you are having trouble finding a dentist in network that meets all your preferences and, you know, maybe specializes in something. So I don't see any questions coming in. So with that, I will close out.
Actually, Dana?
Yeah.
Dana,
Yep.
I'm sorry to interrupt. I do see a question.
Oh, okay. Maybe you see it on your side.
I do, actually. I'm sorry. So I see,
Okay.
I'm going to have to click through the question. What can I do if I don't have confidence in my hygienist? My dentist has had several hygienists, and sometimes I leave and I don't feel like they've done a good cleaning. So I guess that's kind of a, oh, look, I could make it do that. You know, so like how to help somebody feel as though maybe they can provide constructive feedback to a provider.
My advice in this situation is I would try and discuss it with your dentist. I think it's a little bit easier than telling your hygienist that you don't feel like they've done an adequate job, if that's easier for you. But if you do feel comfortable talking to your hygienist, I would say try and decide what areas don't feel right. So I've walked into plenty of exams and my patients have said, I still feel like it's rough on the lower part of my teeth on the inside where my tongue touches. And that's very typical because that's where you collect a lot of plaque. All of your salivary ducts are under your tongue and your saliva will pool under there and you just get a lot of tartar buildup in that area. So I think being open and honest and saying, you know, it feels like there's something going on in this area, and then they should go in and check and make you feel more comfortable that things are cleaned up. If they don't do that, then I would talk to their dentist. And if you don't feel comfortable doing that, then I would ask if you know anybody that has a hygienist or a dentist that they really enjoy going to, then I would ask your friends for advice, or call and see other dental professionals that you can try and go and see, because I mean, you really should feel like you have squeaky clean teeth and there's no roughness anywhere after you've had a cleaning. So that's what I would recommend. I hope that answers your question.
Great, and I'm just looking right now, Dana, and I don't see any additional questions.
Okay, that sounds good. So thank you again to Dr. Skrombolas. We're always happy to have you on for one of these webinars. And thank you everyone for joining. I hope everyone has a great day.
Thank you.
Thanks.